Hi, this is KJ from V101.5, and right now we're with Susan Angel, the Clinical Director of CNS Healthcare. Susan, how are you doing today?
Good, thank you. How are you?
I'm great. You know, we hear a lot about clinical trials. What exactly is a clinical trial?
A clinical trial, for our purposes, is a clinical research study. And what we do is we evaluate the effectiveness of new medications, including the safety of those medications. And then we also look at existing medications for possibly new indications. So,
okay. Who can get these clinical trials?
Anyone can participate. It's purely voluntary. They do have to meet entry criteria for participation, and we ask that they come in for a pre-screening appointment, which will determine, based on their symptoms, their medical history, whether or not they would qualify.
Okay. That sounds good.
Yeah.
You know, I have a lot of friends that, sometimes I talk to them and they're like, I'm just not feeling good. I'm feeling kind of down, but it'll probably pass by the weekend. But then it never does. How do you know if you have depression or bipolar disorder? What are the symptoms?
Well, depression and bipolar disorder are two very distinct conditions. The best way to figure that out, obviously, is to be assessed by a trained clinician. People with depression, it's the blues that just doesn't go away. It does stick with you, and things that you notice are reduced energy, reduced motivation, problems getting simple things done. Like it's even hard getting out of bed, getting your makeup on, things like that, getting to work. They also note problems with concentration, not able to stay focused, forgetful. There's also feelings of being overwhelmed or stressed, and those are things you see a lot with depression. I mean, if those things are there for an extended period of time and don't go away, you should seek out some help. Bipolar disorder is a more vast type of condition. There's varying moods. Patients complain at times of feeling depressed. Then there's also periods where they may feel elated or grandiose with excessive energy. And there's sometimes the mood falls in between. But either one of those can be disruptive, in your family life, in your personal life. So if any of those symptoms are occurring, it's best to get evaluated.
Right. Great. A lot of people might say, well, I'm not feeling that great, so I'll just go see my doctor. What can people get out of a clinical trial that they can't get from their doctor?
Well, as you know, the doctor's offices are very busy these days, and you've got a very limited time to get in and get out and get your problems heard and addressed. And with the clinical trial, it's very neat because you get to see the doctor and the clinical team each week, basically, for an extended period of time. So you've got that time dedicated to you and the symptoms that you're having. And not only in this situation are we looking purely at your mental health status, but they also do physical exams, laboratory testing, diagnostics to make sure there's no underlying causes of the symptoms that you're feeling. So it's a real holistic approach, and you're thoroughly assessed each week.
Well, Susan, thank you so much for coming.
Thank you for having me.
And I hope you got more information about CNS Healthcare.